Good afternoon, and thank you for joining us for our Breast Cancer Awareness Special. Each year, 18 News and Guthrie team up to bring you everything you need to know about the latest life-saving technologies and recommendations. With me here today are Dr. Geneva Ballard and breast cancer survivor Diane West. Thank you so much for being here and, of course, for sharing your stories. So each year, it's always the same type of thing right off the top. You know, we talk about early detection and screening. Why are these things so important?
Well, early detection is always important because the prognosis of breast cancer is really based on the stage at which it's diagnosed. So we want to find cancer at its absolutely earliest stage when it's the most treatable. Finding a cancer with screening mammography is much better than waiting till months to years later when you'd be able to feel it clinically. The prognosis is just going to be much, much better if we can find those cancers in their preclinical stages.
And Diane, we're about to see more of your story here in just a few moments, but what would you say your biggest takeaway with your whole experience with breast cancer was?
I guess the biggest takeaway is never take your health for granted. I've always been a healthy person, and up until my diagnosis, I had never even really been in the hospital other than when I had my children. So I just value every day now. It's the t-shirt I'm wearing is today I choose to live life to the fullest, and I think that's been my philosophy since then.
Well, here's more from Diane and some of the doctors she worked with throughout her journey.
1 in 8 women will be diagnosed with breast cancer throughout their lifetime, but thanks to new technology, doctors are finding it sooner and smaller. Guthrie recommending yearly mammograms beginning at age 40.
We feel if you have a mammogram every year, you are doing the most you can to find that cancer early and get it treated. And that's when you want to find it as early so you can get it treated.
In addition to the traditional 2D mammogram, Guthrie is also recommending to all its patients a newer 3D version with the ability to find cancers smaller than before.
This is something that may have been not picked up possibly till next year on this patient's breast, which is a big deal for a cancer to not be picked up for an additional year. So that's why this 3D is so important.
As part of Guthrie's new high-risk program, each woman who comes in for a mammogram will also be asked a series of questions aimed at determining each patient's level of risk. Depending on a woman's score, she may also qualify for the next level of screening, breast MRI.
We risk assess them, and if they have risk factors such as their mom had breast cancer at age 45, maybe their grandmother also had breast cancer, it also has to do with how many children the woman's had, whether or not she's breastfed, other factors like that go into this risk score. It's called the IBIS score. If the IBIS score is 20% or above, then these patients qualify for screening breast MRI.
That high-risk program offering more tailored, personalized care for women with a family history and other risk factors. It all starts, however, with making and keeping your mammogram appointment.
Come in and judge for yourself. So you come in here and we do your mammogram and you hated it and you never want to have another one. You know, that very rarely happens. You get in here and I take that first picture and that patient says, "That was it? Oh my gosh, I've been so scared. I didn't want to do this and everybody's been telling me how much it hurts." And then they're like, "Oh, I would have done this sooner if I'd have known it was this easy." And you know, to save your life, possibly to save your life, it's just so worth it.
Diane West of Corning knows firsthand the importance of regular checkups. Just last year, she was diagnosed with breast cancer, but because it was found so early, doctors were able to remove it with surgery and radiation. No chemotherapy, no hair loss, and today, Diane sits before us, cancer-free.
It was a little bit of a roller coaster, but nowhere near what other women have gone through as far as the treatment and everything that they've had to experience. So I feel very fortunate that my cancer was found very early.
Diane using her story to encourage others to be proactive about their health.
Get yourself checked. Make sure you're all right. You know, have the peace of mind that you are okay. But if not, they can find it early, they can treat it early, and your chances of surviving are so much greater.
So Diane, quite the roller coaster there, you know, from diagnosis and then, you know, learning you didn't have to do chemo. That had to have been some form of relief, right?
Well, sure. I know women who've had breast cancer and have had to go through chemo. They've had mastectomies and reconstruction, and I was really fortunate to have mine found early and not to have to deal with all the additional the discomfort from the chemo and the loss of the hair. So I was really relieved to know that I didn't have to do that.
Absolutely. And Dr. Ballard, we also heard in there that the number of pregnancies a woman goes through can have something to do with her level of risk. Explain that.
Yeah, so it's actually a relatively minor risk factor, but women who have multiple pregnancies, you know, the changes in the ratio of estrogen and progesterone during pregnancy can affect your risk for developing breast cancer later in life.
Oh, wow. So definitely something to keep in mind. Thank you, Dr. Ballard. And here's more on Guthrie's high-risk clinic.
So like your mom, your sister, say was like 40 years old and had breast cancer, that really increases that patient's risk. It sometimes increases the risk so much so that we even not only recommend the screening breast MRI because of their elevated IBIS score, but sometimes these patients also qualify for genetic screening.
When somebody comes into my office for genetic testing, we do a whole pedigree or a whole family history, and we actually write down every person in the whole family that has had any kind of cancers. And oftentimes that sparks thoughts from like, oh, my aunt had it, and you don't really remember until you have to write it down, so that's really helpful.
From there, you could be a finger prick or mouth swab away from knowing more about your chances of getting a whole host of cancers.
It tests 43 genes that we all have just to see if there's any mutations on those. And all different mutations have all different risks for different kinds of cancers.
And with a 1 in 8 chance for breast cancer, the more we know about our risk, the better.
There are some mutations that increase that risk up to 87% chance of getting breast cancer in your lifetime. So again, knowledge is power, and if you have a mutation, and you should know so you can do something about it.
Depending on the results of your genetic test, you could also be referred to Guthrie's high-risk clinic, which may sound like a scary program to be in, but it actually offers more and better screening options that could save your life.
And we also use risk evaluation tools that take into account your personal history and your family history to give us an estimated lifetime risk of you developing breast cancer. And based on that risk assessment, we're able to make recommendations whether or not you should be screened as a high-risk patient.
And this is one of our recent patients, actually. On her mammograms, completely normal 6 months ago. She has very dense breasts that are difficult to see through. But this here, this is her right breast, and this is a cancer in her right breast that you can see here and here that is enhancing with our IV contrast material. And it is only found on the MRI. We went back and looked at the mammogram. You can't see it on the mammogram. So for this woman, this was very important that we were doing this additional high-risk screening, which she qualifies for based on her family history of breast cancer and multiple relatives.
Just one example of how a few minutes of your time could not only save your life, but your loved ones as well.
Also affects your whole family, and so you can give that gift of protecting them and the information, so hopefully we can prevent another cancer in the family.
Dr. Ballard, that whole process really starts with a questionnaire at your first mammogram, or your yearly mammogram. Talk about how simple that is to fill out and how important it is.
So we're really looking for patients who have strong family histories of breast cancer, and the kind of red flags for that for us are going to be a patient who has a first-degree relative, so a mother or sister with breast cancer, or 2 second-degree relatives, so grandparents, maternal or paternal aunts on either side of the family. So if we see those kinds of red flags at the initial discussion that we have with a patient at the time of their screening exam, we do a more in-depth family history-based risk assessment, and that we can really get more into the personal and family history risk factors that might increase a woman's risk for breast cancer. We really want to identify those patients who are at very high risk for breast cancer because the recommendations for screening change for those women. So instead of beginning at 40, we would begin as young as 30 for very high risk women, and we'd also recommend the addition of annual screening MRI in addition to mammography for high risk women. So they would get both mammography and MRI annually for screening. So that's quite a change to our recommendations based on a person's risk for developing breast cancer in their lifetime. So we definitely want to identify those patients at the earliest time when we can.
And Diane, I know you have a daughter. So doctor, is this something that Diane and her daughter should be talking about eventually?
Yes, definitely. So her breast cancer diagnosis is going to change her daughter's sort of estimated risk for breast cancer. It doesn't mean that she's definitely going to get breast cancer, but we would potentially, want to be talking to your daughter as young as 30 about her risk and doing a risk assessment, potentially begin screening earlier for her depending on her estimated lifetime risk.
All right, well, we'll have more just after the break. Welcome back to our breast cancer awareness special. So moving on, Diane, I know you had surgery as part of your treatment. Talk about what that was like. As you had said earlier, you've never been in the hospital before, you had your children. So what was that experience like?
It was definitely very scary. That the surgeon that I had really, talked about what the surgery was going to be like and really talked about all the different steps. So I felt more prepared going into the surgery. I also had two very good friends who came to the hospital that day and were sitting there waiting for me after I came through recovery. Knowing that they were out there was definitely something that really gave me peace of mind. But the nursing staff, everyone that I've come in contact with has just been so supportive.
And there's so many options out there. Here's some of Guthrie's surgical and reconstruction teams with more.
Surgery is still considered the primary treatment for most solid cancers, including breast cancer.
Depending on the size and severity of the cancer, a woman's doctor could suggest everything from simply removing the lump from the breast to removing the breast completely. Diane West considers herself one of the lucky ones. Because her cancer was found so early, she was able to undergo a smaller surgery with a quicker recovery time.
I have coworkers that have gone through breast cancer, that have had mastectomies, that have had reconstruction. They've experienced going through chemotherapy, and it's a real big challenge. It's a lot to go through, and it affects your life, it affects your work and your family.
Thanks to new technology, there's beginning to be more stories like Diane's.
Many patients are candidates to have breast-conserving therapy. Not everybody needs a mastectomy. Some patients do need mastectomy, and then it's nice that we have plastic surgeons who are available to do breast reconstruction for those patients.
For those who do have to have a more involved surgery, there's a team of specialists at Guthrie dedicated to making you feel whole again.
Having somebody return to their former form and function, get their breast contour back, get their volume back, is really an important part of the healing process, not just from a wound perspective, but a psychological perspective as well.
And while there's a large number of surgery options, there are even more for reconstruction, each tailor-made specifically for the individual patient.
There are a lot of considerations, such as how many stages somebody wants to go through for a reconstruction. There's certain reconstructions that are a one-stage reconstruction. There's some reconstructions that are two-stage or three-stage. And so there are a lot of factors related to that.
And while getting that diagnosis and facing surgery can be a very scary time in a patient's life, there's a whole community of survivors ready to lend a helping hand.
I find women who come to my clinic like hearing about the long line of women who unfortunately have suffered the same diagnosis before them, and the long line of women that are coming after them. All strong, all resilient, all stared this cancer down and beat it and worked through it and went through their reconstruction and got to the other end.
So Dr. Ballard, I know you work a lot in radiology, but you also sit in on a lot of meetings with some of these doctors that we just saw. Why is that important for you to all work together?
So we all work together, and we actually meet weekly to discuss all the new breast cancer diagnoses and talk about the imaging aspects of their disease as well as the treatment options for each patient. So a part of those discussions and having a collaborative approach is really very important to planning the best care. Everybody has a little piece of the puzzle, but when we can all come together, we can really collaborate to plan the best treatment for patients.
And Diane, before we go to our next story, I wanted to ask you, your cancer wasn't detectable other than on a mammogram, right? You didn't find a lump or anything like that?
No, as a matter of fact, I went for my routine mammogram not realizing that there was anything wrong. And in fact, even the nurse who had done my manual exam had said she hadn't detected anything. So the mammogram really was life-saving for me.
Absolutely. And our next inspiring story of survival comes from a young mom whose life was changed when she found her pea-sized lump one night before bed.
I just thought it was, it was probably a benign cyst or something. I didn't really worry about it too much. But being a nurse and being familiar with, the guidelines and the recommendations, always get it checked out. So I made the appointment the next day. I didn't wait.
With no family history and at the time 15 years under the recommended age for screenings, Tara thought for sure the bump was nothing. She soon learned different, however. Tara was diagnosed with stage 2 invasive cancer.
It was terrifying for me, more, not for myself, but for my daughter. My daughter turned 4 that year. She just turned 4. And the thought of me not being around to watch her grow up was the worst feeling in the world.
It was her daughter, husband, and the rest of her family and friends that would help Tara get down the long road of recovery ahead of her.
My treatment course started with surgery in May of 2017 and then took me down 20 weeks of dose-dense chemotherapy and about 5.5 weeks of radiation therapy.
Tara focusing on being a wife and mom over a patient.
My husband and I tried to keep life as normal as possible for my daughter, but also because I think that's what got me through the treatment and not focusing on what was happening currently in the moment, but always having my mind busy on something else. The things that you would think would bother you the most, like losing your hair, is not the bothersome thing. I think you just expect that to happen. So you're already geared up for it, you're aware of it. That losing my hair affected my daughter much more than it affected me. That was really traumatizing for her, I think.
Tara thankful for the new developments in medications that helped her manage some of her side effects.
Treatment has come so far in the last several years, and how to manage the side effects. There's steroids and there's other medications that help minimize and mitigate those side effects. They're still there, definitely. They're still there. There's days where some days are worse than others. Some days you feel relatively normal, but yeah, it's tough. It's tough. You're definitely on a countdown from the first infusion. You're 1 down. 19 more to go.
For Tara, some of those side effects will last for the next 5 to 10 years as she continues to take oral chemo due to the nature of her cancer. Tara already planning to use those years to educate her daughter about the importance of being proactive.
I think this is something that she's never going to forget. So I think as she grows older, we're going to have those conversations always. Does it put her at greater risk? Probably, because her mom was a direct relative that was diagnosed so young.
A living, breathing example of why knowing your body is so important. Tara now uses her own story to encourage others to do the same.
You really have to be aware of your body, and if you see something, say something. You have to make sure that it's better to be safe than sorry. Mine was a very fast grower. It was very aggressive. So if I would have waited a couple of months, it would have definitely spread further than just the closest lymph nodes. And there's a chance I could have been stage 3 or stage 4 if I would have waited a couple of months. So always be vigilant.
So Dr. Ballard, as we heard there, Tara was much younger than the recommended age to start getting those screening mammograms. So what do you recommend for young women?
So we talk a lot about identifying high-risk patients, especially even in their 30s. But honestly, most patients who are diagnosed with breast cancer don't have any family history at all. So it's important for all women to begin screening and to begin having those discussions with their doctors. For patients younger than 40 who would be getting screening mammography, and really for all women, it's important to just be familiar with your own breast tissue, to know if something feels a little bit funny or different, or you start having a symptom that you really go ahead and take that step and get it checked out. Don't just assume, I'm only 30 years old, it's probably a cyst or probably nothing. I'm happy to tell patients, oh, good news, it's just benign. Thanks for coming in and getting checked out, rather than having patients ignore something that could really be a problem down the line.
Absolutely. Well, we'll be right back with more after this break. Welcome back. So to wrap up our breast cancer series this year, we're taking a look at some of the people at Guthrie that are there from diagnosis through treatment and even years way after. Diane, talk about the support that you found through all the folks you worked with at Guthrie.
Well, it actually started the day I had my mammogram and my ultrasound. One of the nurses there, she's a breast cancer survivor, and she looked right at me and she said, "I'm a survivor and you're going to be okay." And from that moment, you know, there have been doctors and nurses and friends all along the way that have really been there to support me when I was starting to doubt or starting to feel like, you know, things weren't going to be going the way I wanted them to. And they were just there to say, you know what, you're going to beat this. And that support was extremely beneficial for me.
And here's a look at some of the other people there to help you through your journey.
Cancer is life-altering. So you get a cancer diagnosis and everything comes to a screeching halt. Your priorities are different. What you thought was important at one time may not be important anymore.
At first it's very scary because you don't know everything that's going to happen. You don't have the whole plan developed yet. But just trust us here and walk with us here because we're here to help, and you know, we have wonderful treatments now that we didn't even have even 10 years ago.
Yes, it is shocking to get that diagnosis, and a lot of uncertainty at the outset, but as you go through each step of the treatment, and you know, you begin to cope better with it, and you know, most patients again will have a good outcome.
The most common thing I think is just the overall support. They're not alone, and that there are resources and there are people out there to support them. That, you know, they don't have to be afraid of what's to come, that we're going to support them and we're going to provide that information and those answers, which could be financially based, could just be an emotional adjustment to it, could be employment based, how they're going to balance work schedules, treatment schedules, life schedules, just, you know, how does this fit into where they're at in their life.
The things that I might have taken for granted before, I don't take for granted anymore. My family, my health, time is definitely, and I make sure that the most important things, they know they're important, that my family knows how important they are to me, and by me spending time with them. So I think out of all of this, the biggest change for me was just really understanding the blessings in my life and making those my #1 priority.
I get to see patients through the entire process of their treatment, and I get to see women who succeed in their fight. I follow up on them for 5 years after their diagnosis, and sometimes even longer. People choose to be seen by a specialist, and so I have women who are 20 years out of their diagnosis, and it's amazing.
And Dr. Ballard, you're right there oftentimes from the very beginning of a diagnosis. Talk about what makes your job so rewarding.
Well, I think the thing that makes it so rewarding is that really when we find cancer early, the prognosis for these women is absolutely excellent. They're going to live full, long, healthy lives, see their grandkids grow up. It's really a different disease when we can find it at its earliest stages. And that's really my goal, is to find cancer at its earliest, most treatable stage and give women the opportunity to live a full, healthy life. So that's what I feel is most rewarding, and honestly, the best part of my job is, even though I'm there at a difficult time for women, a time when they're being told that they have a very scary sounding disease, their experience of that moment can be very different when they have someone who is able to comfort them and guide them and say, hey, this is bad news, but we're going to make it and it's going to be okay.
Absolutely. Well, thank you so much for being here, and thank you for joining us for our Breast Cancer Awareness Series. Have a great day.